Thank you, Adam. أهلا ومرحبا بكم. Good day, everyone. Thank you for joining us and welcome to the first session. Let's go viral of digital communications, health communication, theme of APPIS Summit 2023. Before starting, allow me to introduce myself. My name is Bahija Gouimi. I'm teacher and also founder of AMAL organization dedicated to support leukemia patients in Marrakesh, Morocco. And I am myself a leukemia patient. I'm extremely delighted to be part of the APPIS Council for 2 years, representing the Middle East and Africa region of chronic myeloid leukemia, CML, Advocates Network. It has really been an amazing journey full of learning, collaboration, networking, and inspiring stories. APPIS made it possible to strengthen patient communities and improve patient outcomes in the region. And one of the ways of reaching these goals has been digital communication. Digital communication is indeed a life-changing tool in turning problems into solutions. And now we are going to discover together how can a lemon be a great tool to raise awareness. To do that, we have with us today Dr. Corrine Ellsworth-Beaumont, the CEO of Know Your Lemons organization. Hello, Corrine. Thank you for being here.
Hello.
Could you please introduce yourself?
Yes, absolutely. Thank you so much. I'm really thrilled to be here. My name is Corrine. I am the CEO and founder of the Know Your Lemons Foundation. And my background is that I am a graphic designer, and my PhD is in how to use patient-centered communication approaches in order to communicate to a global audience. So my work is centered in how can you come up with a visual way to communicate a topic that works across various languages, overcomes different obstacles, particularly in breast cancer. And then how can you do it in a way that improves health equality, patient literacy, et cetera. The reason why I'm so passionate about this is because I lost both of my grandmothers to breast cancer. And because of that concern, I wanted to learn for myself what I should be knowing for my own health. And as I explored that, I realized that there wasn't just a single resource that was really easy and included all the information that I was curious about. So I used my design skills to explore how to make this information easier to understand. And I'm excited to share it with you today, as well as the work that our organization does in the Asia Pacific, Middle East, and Africa regions.
Thank you, Corrine. Thank you, Corrine, for sharing your experience with us. I know that talking about breast cancer is not easy. Can you please share with us why is breast cancer is so difficult to discuss?
Yeah, so there are three main barriers that we face when we talk about breast cancer. The first one is that breasts are often associated with sex, and that leads to a lot of censorship. People can feel embarrassed about the topic, and it might not be something that they're able to access very easily because of those barriers. The second barrier is fear. And cancer can be often associated with death, and so patients will avoid the topic altogether. So when you have those two things combined with breasts that have a taboo and cancer that's associated with fear, that can create a lot of barriers in being able to talk about the topic and making it something that people will want to engage with.
Yes, indeed, Corrine, that's exactly how I feel coming from North Africa. We have our personal, challenges facing breast cancer. And the most important ones are related to social and cultural issue because women bodies are still sexualized and women are shy to talk about their health problems, especially their bodies, and ashamed to show their bodies to doctor and to nurses and to everyone. And And this is what they are not seeking help and asking for help, and unfortunately diagnosed it at late stages. And definitely we are all aware that breast cancer prevention and early screening programs are a pressing need in the region. Going back to Know Your Lemon campaign and to you, Corrine, how did you come up with this idea of a lemon?
Thank you. So let's go to the next slide and we can look at this together. So no matter what language you're listening to this presentation today, this image is going to communicate breasts to you without having to show any breasts whatsoever. And that's the great thing about using lemons, is that it has nipples and skin without being a breast. So that means we can overcome censorship issues. And it's also a very friendly picture. Another great thing it can do is in this next slide, which is communicate what a cancerous lump can often feel like without using any words. And so, our campaign is global. We're having to communicate in lots of different languages, and being able to have something that people can instantly look at and recognize is really key. So it's not only a good metaphor on the outside, but it's also a good metaphor on the inside. And if you look at the next slide, you can see that breast anatomy and lemon anatomy is actually really similar. And so being able to use this familiar object that people will have had some experience with can make it really easy to teach these other kinds of concepts. So in the next slide, you can see how this is further explored by explaining breast anatomy. So, women are often told to check for a lump, but breasts are actually pretty lumpy. And so being able to explain that there are lymph nodes and milk lobes and milk lobules in the breast that can feel like soft cooked beans or soft cooked peas can help women better understand the different lumps in their breast, and how a cancerous lump is going to feel very different from that, which is illustrated there. We talk about that a lump can be any shape or size. And we have lots of, different ways of helping people understand so that they can be more empowered. But this next image is the one that we're really well known for. And this is illustrating the 12 symptoms of breast cancer using lemons. So this campaign is now in 33 languages, and it's been responsible for saving the lives of many women. We often hear people saying that they saw this image on social media and it got them to decide to do self-exams. Women have said they noticed a change in their breasts, and it helped them have confidence that they had something that needed to be looked at by a doctor. Sometimes women will go to the doctor and they will be dismissed. But women have said because of this image, they knew that they should advocate for themselves and push for testing. And that's what led to their early diagnosis. And then, as you can see there, we have a little QR code where we have an app that can navigate patients as well.
I'm really impressed by this creative idea. Let me say that it's amazing. I'm not going to see the lemon like before. I mean, this changed the way people look at lemon today. That's really inspiring, Corrine. But how do you reach global audiences?
Yes. So, one of the ways that we reach global audiences is through our volunteer educator network. So here you can see every pink dot is someone that we've trained through our online volunteer educator course. We teach them breast health information. We start from the very beginning, the very basics. And then we provide them with digital education tools, sometimes physical tools, that they can use to go and teach Know Your Lemons classes in their local regions. And it's really empowering to see all of these women, often women who have had breast cancer themselves. They say that being able to go out in their community, have tools that make it easy to talk about breast health, makes all the difference in them feeling like the thing that happened to them is something that they can do something about it. They can make sure that somebody else can be educated and have a chance to be able to get diagnosed earlier. If you look at the next slide, I can tell you a story about how we adjust the campaign. in different parts of the world, because in some parts of the world, lemons are green. So this is our campaign in Portuguese. And then in the next slide is examples of what we've done in Africa, where we did a study with women and doing the campaign with them. And they reported that 96% of them felt more confident in being able to recognize a symptom of breast cancer after the class. 98% said that they would report any breast changes to a doctor, and 92% said that they'd share the image with family and friends. And so they're holding some materials there and some fridge magnets that they're sharing with others. In the next slide, you can see one of our volunteer educators from Indonesia. His name is Jumatil Fajar. He became a trained Lemonista, as we call our volunteer educators, a couple years ago. He has taught over 2,000 women on his own. And he's able to teach in even the most conservative of settings. So if we see the next slide, this is Jumatil teaching in schools. And so he's able to be a man. He'll go to like Muslim boarding schools for young women. And as a man, he can stand up in front of this classroom and talk about breast health without any barriers whatsoever. So students are able to take home these cards in their own language, where they can start conversations with their families about breast health. And in the next slide, you can see even the boys are interested in being able to go home and talk to their mothers and their aunties and their grandmothers and families about breast health, which is really exciting.
Wonderful, Corrine. I'm really impressed by what you are doing, and it's clear that you have a strategy to make your education campaign viral by touching the maximum of target audience. Now, looking back, is there a recipe for success, and what are the key ingredients, Corrine?
Yes, let's look at that recipe for success together. So the first step is to communicate on a level that people are comfortable with. So sometimes people have said, we need to call breasts breasts and not, we should show pictures of breasts, we should draw pictures of breasts, but actually you need to communicate in a way that your audience is comfortable. The second one is to avoid large amounts of text. It can be really tempting to try to tell people everything you're wanting them to know. But visuals, as you can see, can be really powerful ways of helping people remember the information that you're sharing. And, when we look at visuals, there's an emotional connection we have with it as well that's quite instant. So, focusing on visuals is really key. The third one I would suggest is to work with a professional designer who's willing to see the issue from your audience's point of view, working with the audience so that they can be able to gain that insight. And then to design with curiosity in mind. So do something that's going to be a little bit different, something that people will say, why are lemons sitting on a couch? And why are there 12 lemons inside of an egg box? That will make people lean in and want to investigate the image a little bit more. So that can help things be more memorable. Next is to be inclusive. So consider the types of people that need your message and invite them to give feedback as you develop your campaign. One example was we had a closed Facebook group. And so as we would develop different things, we would ask patients, how do you interpret this image? What does this say to you? And we were able to do lots of different rounds of feedback through testing in lots of different ways, just by asking people, what does this image say to you? So one example was we had the 12 signs of breast cancer, and we removed all of the text labels on the symptoms and asked people to say, which symptom is this? And that helped us identify if we were communicating accurately. And the last one is really important, and that's share facts that illustrate the behavior you want patients to take. So it can be really tempting to say, most women don't self-exam, but you really should. What happens with that is that you normalize the behavior that most women don't self-exam, and people become more comfortable not engaging that behavior because you've normalized that for them. So instead, normalize the behavior that you want them to have. So for example, most women wish they knew more about self-exam. And then that can be something that you can use to gain a lot of momentum.
I agree with what you said, Corrine, and of course, designing with curiosity and adequate communication seem to be the most important ingredients to succeed. And of course, we have to question if the digital solution is able to solve it, because digital communication can be a great tool, a great innovation. However, it should meet patient needs. For example, if we want to sensitize a target living in a countryside in an African country, digital communication will not be a solution, since people there do not have neither smartphones nor internet connection. However, when we have access to application, it helps to motivate for behavior change, as you mentioned before, Corrine. And now let me share with you that Know Your Lemons app has now a sister, Know Your CML app, designed by CML Advocate Network, available in 9 languages. And Know Your CML app is designed to enable patients to monitor their disease and provide all tools to track it independently. Obviously, it's very, very useful to continue designing viral education campaigns in cancer to reach more and more people. And since digital communications has no borders, I would like to share with you another impressive example on social campaign from Lebanon this time, designed by the Lebanese Breast Foundation using bread instead of lemon. And this campaign is called Khabazti. It means in Arabic, have you baked bread? And we can take our social campaign to the next level and get inspiration from these great examples. And the link to the both applications and Khabazti video will be shared on the in the chat box. Now, Corrine, could you please tell us if there is an opportunity for patients group to play a bigger role in using social media programs to amplify and elevate their efforts?
Yes, we have an opportunity where we partner with different organizations around the world. You can see this on the next slide, where we want people to be able to use our tools. So through partnership, we make our resources available, and we have co-branded licensing, our training courses I mentioned earlier, digital education tools. You can also help us expand the app to your country so that it works for your screening recommendations or your treatment protocols, whatever is available in your region, and your language, and to be part of a global effort to help improve early detection for breast cancer worldwide and collaborate. So please go to that link at knowyourlemons.org/partner. We have lots of different types of partnerships. We really want to make these tools and resources available for everyone. So I hope to hear from many of you after this conference.
Absolutely, Corrine. Patient groups can indeed get involved in the social media programs. I mean, in 2 ways. First, they can help the organization identify the real problems that they face in real time, which is a big advantage of digital platforms that help keep data collection updated through survey, for example. And second, digital communication can allow patients to come ask for help by themselves, because we have this the anonymous side of social media, and it can allow a certain trust for patients to open up without being scared to be vulnerable about their disease, especially in countries with cultural stigmas. Here we go to the last question, Corrine. What is your suggestion on how to sustain engagement with the target audience to ensure continuous support?
Yes, I think it's really important to have a online strategy with social media, and then what you're going to do with that offline. So for example, we have cards where we're taking the same image that's on social media, where people can hand it out to others and have a support system around that with other programs. But really, it's about working with others. The reason why our campaign went viral is because of patient support, and we've seen that in the other messages that have been shared today already, the important role that patients play, not only in being able to develop good materials, but in order to be able to share them as well. So build your network and make it something that others will want to share as well, and you will be a success.
Thank you, Corrine, for your inputs and valuable presentation and answer. Thank you also for your lemons. We are looking forward to partner with more organizations to help get education for breast cancer and CML, and allow other organizations to be inspired by the best practices for better efficiency. Actually, what we presented today was a small insight of what we are able to do thanks to digital technology, and it's the beginning of a new era in the healthcare support organization. We tried to cover as much information as we could in this 20-minute session, but it's not all. Please do not hesitate to stay connected for more opportunities for us to share best practices. And also, Corrine and I will be more than happy to answer to all your questions after this session through our social media platforms. Thank you for joining us. We are looking into the ongoing engagement post-summits. And now we are moving to the next session, and it's my pleasure to introduce my colleague, Rod Padua, Strategic Advisor of APPIS 2023 Council, who will be moderating the next session, The Future of Fundraising. Over to you, Rod. The future is now. Have a good session.